one of the things I always tell about radio frequency, if you've been around lasers or energy-based systems for a while, we were under the impression for a long time that in order for radio frequency to work, it had to hurt. Okay, and there's a lot of us out there that still think if you don't have pain, that there's no way you can generate enough heat in the dermis to cause collagen contraction and then collagen regeneration. And that's always the premise of radio frequency. Heat the skin, create collagen, contraction, and you see, I mean, we're in the middle of a treatment here, and I will promise she's not faking that smile. It's not painful. There is a mild heat sensation, right? Okay, but it's not anything of any concern, 99.9% of the time. So this technology is new in the U.S. It's not new outside the U.S., which is an advantage for us because now we have a lot of experience with it outside the U.S., and that allows us, by the time we have it, to have gathered enough data and enough things to use about it. So it came out in 2006. The RF current flows through 3 electrodes, which is, again, very unique in the radio frequency world. And that RF is limited to the treatment area. So if she can show us the electrodes for a sec. So it's limited to what we're treating right there in each electrode. TriPollar RF simultaneously both superficial and deep dermis. Again, without pain, and I think that's important. It's got an FDA indication now, so very important in our world, is that it's been used outside the US, and that's great. And there's, as I said, a lot of experience, but now in the US we have an indication. And it's actually to treat mild wrinkles, facial wrinkles, okay, and rhytids, so that's good. So we can then take it and now use the other parts of it anywhere we want. So the advantage of this is that we have a device that is user-friendly, face, neck, body, arms, post-liposuction, a lot of different indications. So we have a large, medium, and small handpiece, depending on what we're trying to treat. So body, arms, neck, and face. And then for the delicate areas around the eyes and on your hands, we have another one. Again, because this device isn't new, we don't have to replicate a lot of what's been done. There was a pivotal US clinical trial, and the pivotal trial hasn't been published yet, as far as I know. I'm looking at them. It hasn't been published yet. But it's submitted for publication, and it's submitted for publication, and it will come out. But we have basically 6 trials that have already been presented all over the world, published, peer-reviewed journals of different things that can happen. So this is actually part of the. Steve Shapiro has done a lot of the work in the U.S. To get to where we are. Whoops, this is going faster than I want. And you can see the improvement, especially the tightening that you get and better wrinkle reduction here on the neck. This is what we're looking for. Travis, your machine's going all by itself. So that's okay. It's okay. So, but even after one treatment, one of the things you find with this device that I don't find with every device, and I know I'm moving around, I'm driving you crazy, so you see results even after one treatment. You do the series, it's once a week for 6 weeks. Sometimes in my clinic, it's once every other week for 6 treatments. But you see the results and they continue to improve over time. In dermatology especially, we're looking at the neck. So the neck becomes an area that if we have a modality that can tighten necks without liposuction or without neck lifts. I gave this whole talk on neck rejuvenation at the IMCAS meeting in Paris. It was 5 plastic surgeons and me. And everybody said you have to cut, you have to lift, you have to pull. And then I started showing this. And they're like, but that's not, you can't do that. And I'm like, yeah, you really can do this with this kind of technology. It's the next level of radio frequency. So this is, again, you see the different tightening that you're able to achieve. Abdominal tightening like we're seeing now. This one doesn't need a lot of tightening, so that's a good problem. But this is the perfect patient because, again, she doesn't have any problems, but I see people that'll have one area that they don't like, and I can fix that. And you see the improvement here, and you see the results pretty quickly. So again, you see tightening. So all this works, and again, the data supports it, and it's painless. And anytime, as I said, you can do something that's painless, that's huge. And again, this is what you want. And one of the problems that all of us have when we're using any radio frequency device is predictability. And there's still, the occasional patient that we just don't know why doesn't respond as well as this person. But time in and time again, I'm getting these kind of results. So again, I think anybody that can do this, we show this to our patients and we can replicate that, we're good. So this is one of my patients, and you can already see some of the reduction, especially in the stomach area. And that's just after one treatment. So really nice, and I don't think the Apollogen people have seen any of these. You may have seen a couple, but you haven't seen them all. So here's another patient. This is 3 weeks after 3 treatments. And what you notice about it is the neck definition, okay, and the jawline definition. So anytime I can do this to a patient, why do I have to cut? I mean, I do laser liposuction. I love doing liposuction. But if I have a choice, and this, first of all, it's delegatable. That's the best part for me. I do all the liposuctions, so I like delegating. But I mean, if I can get that kind of jaw definition after 3 treatments, this is what I'm looking for. This is what my patients are looking for. So another very difficult patient who has a lot of wrinkling, but she actually has a lot of tightening, and this is 4 treatments. And you can see the smoothness, it's a lot shallower. She needs some more, and we're treating her. But she's had a lot of photo damage. She actually grew up in LA at the beach and has a lot of photo damage. I show this one more because, again, there is a lot of softening in the nasolabial folds, although it's not the best picture that I've taken. You can see that the results are there. So here's another patient. You can see improvement again in her face, in the contour of her face. Another person, neck improvement. And you can see there is tightening there. And then think of this as well as a cellulite treatment, okay? So we can use this as a way to treat cellulite. Now, I use this more for body contouring. We have other devices for cellulite, but if you need one device that does both, why not? So you can use this for cellulite and improvements such as this here. So you get some really nice results without having to be invasive. And the buzzword in dermatology now is, if you want cellulite to go away, we need to be invasive. And you know what? I don't want to be invasive all the time. So this is really nice, and I think that's pretty impressive. So this works for both cellulite and body contouring really, really well. So I just wanted to show you some of those pictures on what we had. So you can. Where's Travis? So Travis, he can put his video back on. So that's TriPollar. I mean, it's a really neat device. It works. Your patients are happy. It's a series of treatments. You got to keep that in the back of your mind. But my patients are seeing results after 1. But you need to do this series. You need to explain to them, if you're going to sell this in the office, this is a package sell. So you charge X amount of dollars or pesos or what's Brazil? Cow? Okay. Sell it for that, but so if they buy the package, you can reduce it a little bit instead of an individual treatment packet, cost, and it becomes an easy sell. And we do this series, and then once we do the series, and again, I'm not used this machine more than 3 or 4 months now, and that's the results we're already seeing. We're telling our patients now we want them back once a month. And I'm treating most of them at this point on a once a month, and some I'm going once every 2 months to see what they can do and what our maintenance schedule. Because one of the biggest problems in radio frequency is nobody's ever defined maintenance schedules. So we're actually looking at this and seeing if we can come up with some plan, whether it's going to be a month for 6 months or every 3 months or every 6 months. But we want to explain to our patients that you may need some maintenance, and that's okay too. Again, if they sit there like this, it makes life easy. Because again, if you think about the original monopolar RF device, it's my fan club. If you think about the original monopolar RF device, she wouldn't be sitting there like that. Okay, no names, but she'd be jumping up and down. She'd be out that door, and you know, that we don't want anymore. Okay, all right, thank you all.